image optimization. Basically, we are going to cover probe orientation. Little bit we'll touch upon because that topic requires a little more attention. So it's time taking. In image optimization, what are your learning objective today is how to set up your ultrasound machine, how to ensure your image will look as good what you see in your books, and how to get the correct orientation of that image. So I hope you have revised the last class. What we have discussed, we discussed that ultrasound wave requires a media to travel. Higher the frequency, better is the resolution. Higher the frequency, lesser is the penetration. We also spoke about artifacts and we spoke about thermal and the mechanical index. If you have not completed that class, please go and revise that before you come to this class. In any machine, whatever company you're using, be it Samsung, GE, whatever, you have certain knobs sitting on your machine panel, which you should know how to adjust. Many a time, your application specialist will tell you, you can use this, touch this is best for obese patient, this is for NT, this is for growth, Doppler. Yes, they can do it. But as I always give an example of you, if you are a good driver, you should know how to make your car if there is some fault at any point. Similarly, if you are very good at your ultrasound or if you want to increase or optimize your image, you need to know all of these buttons. How to use the power, the depth, the gain, the TGC, the focus, zoom, Sidilu, all of that you need to decide and you need to adjust accordingly. Now,
Ultrasound begins with a simple principle. Sound waves travel through the body, interact with tissues, and return as echoes. But how those echoes are generated, received, and processed determines the quality of the image you see. Understanding ultrasound physics and technology helps clinicians optimize imaging, recognize artifacts, and make more confident clinical decisions.
Which I showed you, here is the placenta, here is some fetal part, but the fluid is looking echogenic. So here the gain, which is 23, is too much and we need to decrease the gain. How will you decrease it? By this. Too bright, not good. Too dark, not good. What is appropriate gain? Appropriate gain means the fluid should appear anechoic. Anechoic means it is not reflecting any sound wave. Now coming to next. Next is focal or focus zone. Now, tomorrow is your exam. I gave you an entire book to read and you have not read the entire year. Or other example is tomorrow is your exam. I just give you 10 questions to read and go before the exam in which you will perform better. If you have the question paper itself, you are going to perform better. Why? Because you are focusing on high risk area. You are focusing on your subject of interest where maximum question will come from. That is what we mean by adjusting the focus. Now, this is the focal button. You just have to move it up, move it down, and you can adjust the focus. Now, see how this is the focus button and just see how this will change. And as this change, just watch the uterus, how the uterus will become better. This is all transabdominal images. Just see. See. Can you see how the clarity is changing? And this is the focus button. I went somewhere, it's not needed. So ideally, where should be the focus button? Ideally, the focus button should be here at the level of uterus, not here, down, and not here, up. So you need to keep this focal button at your organ of interest. Next is frequency. Now, any probe, if you see, we have discussed all of this. Every probe, like an abdominal probe, they will say curvilinear probe, it produces a frequency of 3 to 5 hertz. In a transvaginal probe, the company will tell you
The focal zone is the region where the ultrasound beam is most tightly focused, providing the best lateral resolution.
By adjusting the focal depth, we can position maximum beam concentration. This occurs at the level of the structure we want to examine.
For optimal image quality, place the focal zone at or just below the structure of interest. Proper focusing means better detail, better resolution, and more confident interpretation.